Managing to live comfortably with your diabetes. Diabetes is a chronic disease that affects millions of people. Left untreated, it can be deadly. Diabetes can strike people of any age. Therefore, it is imperative that you recognize the symptoms of this disease so you can get immediate treatment for yourself or a family member, if necessary. The following video provides you with answers to all of the questions you may have about the different types of diabetes and how they can affect your life. Diabetics are recommended to increase their intake of cinnamon as it's been shown in scientific studies to keep blood sugar from spiking during a meal. I love to add it to oatmeal or cereal, and I also bake banana muffins with at least 1 tablespoon of sugar each so I know I'll get my recommended daily dose. Want a tasty treat that won't be forbidden by your doctor due to your diabetes? Try nachos. Use a low-fat cheese, low-fat sour cream, homemade guacamole, and salsa, and you'll be getting a ton of nutrition with a burst of flavor. If you add some beans to the salsa, you'll have an even healthier snack. If you have diabetes, then your children are more susceptible to the disease themselves. Make sure that any diet changes you make are reflected by the eating habits of your children, and that you include them in the exercise you do. It's more fun to make the changes in your life if everyone has some input. Diabetics must remember that cough lozenges are still candies. Try to buy herbal lozenges which are sweetened with honey, or options that have artificial sweeteners, to make sure that your blood sugar doesn't spike while you have a cough or cold. We have to be so careful about absolutely everything we ingest. Make healthy choices when you go out to eat, but don't go overboard. You don't have to starve yourself on salads, but replacing the fatty fries that are served with steamed vegetables will make your meal less likely to spike your blood sugars. A diabetic has to be careful, but doesn't have to be anorexic. If you are the primary caregiver of a person with diabetes, you may need support also. You carry a heavy load caring for and making decisions for your loved one as well as monitoring their diet and lifestyle to keep them healthy. If you feel overwhelmed, ask for help. Your doctor can recommend respite care to give you a break, or even a nurse to help with care. You don't have to do it alone. The key to a diabetic diet isn't necessarily cutting anything out completely, but instead is about counting up what is in that food item and eating it in an appropriate moderation. For example, having a slice of cake can be fine as long as you work it into your meal and have a smaller piece than you might have pre-diagnosis. Educating yourself on the various types of diabetes and their risk factors, causes, symptoms and treatments, can help you to manage the disease if you've already been diagnosed with it or to recognize its onset, if you contract it in the future. Find out all you need to know about this serious but manageable disease through the tips, information and advice presented in this video. Discover how 93% reverse type 2 diabetes with this odd diet hack. Visit secretdiabeteshack.com. Learn how a dying grandpa was saved from diabetes by his grandson. Visit secretdiabeteshack.com. Breaking news. Uncover how a new root cause of diabetes that was discovered by scientists. Visit secretdiabeteshack.com to learn all of this, and more. Link in the description.